Hello guys. So today the topic of our video is the acute management of seizures and status epilepticus. On this channel, I am trying to cover the most high yield topics for the AMC and the most important topics that are seen in the emergency settings. So you have to know the acute management and emergency treatment for these conditions. And I have covered the ETG guidelines, and ETG guidelines are actually very lengthy, and it is very time consuming if you go through all the text that is written in ETG guidelines. So in this series of videos, I am trying to cover all the ETG guidelines of important and high yield topics, and I have just extracted all the important theory points in these notes and in these videos. Straight up the management, what is the straight up drug and what is the straight up drug of choice for certain conditions, so you do not have to go through all the text. So starting with that, I am going to start our topic, that is the acute management of seizures and status epilepticus. So most of the seizures are actually brief and they do not require drug treatment, and they can be stopped at their own. But there is a certain time where we have to administer the treatment. A very important and very dangerous situation associated with seizures is the status epilepticus. Status epilepticus, the definition of a status epilepticus written in the ETG guidelines, it states that it is the continuous seizure activity or repeated seizures without the full recovery of consciousness in between. So this is actually the continuous activity, and these are the continuous seizures, and there is no time of consciousness in between the seizures. And minimum duration that is decided upon to diagnose the status epilepticus is to be 30 minutes. So status epilepticus is actually the continuous seizure activity without the full recovery of consciousness of at least 30 minutes. So it can be convulsive and non-convulsive. No convulsive seizures, convulsive status epilepticus is tonic and clonic, and non-convulsive status epilepticus. These are non-convulsives, and these can be generalized and focal. In generalized, the seizures are termed as the absent seizures, and in focal, they can be partial complex where the awareness is impaired, and if these are the simple partial, the awareness would be intact. So these are the non-convulsive status epilepticus, and this is the treatment for non-convulsive status epilepticus is actually less urgent. Now, what are the goals of managing status epilepticus? So, a very important point: the treatment for seizure should start after 5 minutes of continuous seizure, and because they now there is after 5 minutes of continuous seizure, there is a chance that they can convert into the status epilepticus. So if you get asked at what time you administer the treatment for seizures. If the seizures are for more than 5 minutes of continuous seizure activity, we are going to start the treatment. So what are the goals of managing status epilepticus? First of all, we are going to resuscitate the patient. So while resuscitating, we are going to see the airway, breathing, circulation, and we are going to manage these things first. Then we are going to stop the seizure. What is the diagnose? We are going to diagnose the cause, because there are many causes of seizures. The patient can be of the epilepsy. He is a diagnosed case of epilepsy, or this is the first seizure activity that is associated with epilepsy, or other electrolyte imbalances and other causes that can cause the status epilepticus or seizure. So we are going to diagnose the cause, and if there is any complication regarding seizure due to seizure, we are going to find the complication and treat the complications. So factors that influence the management of the seizure are: what is the type of seizure and what is the setting of the seizure, age of the patient, history and drug treatment, and the treatment that is already administered to the patient. So these are the factors that can influence our management. In certain cases, if the cause is treated, if the cause of the seizure is treated, the seizure is unlikely to recur. So, in such cases, for example, there is an electrolyte imbalance or blood glucose concentration is decreased. So, in this type of cases, if the cause is treated, the seizure is not likely to recur. So, in this case, anti-epileptic therapy is no more needed after the stoppage of the seizures. But if the cause is not immediately treatable, for example, the CNS infections like meningitis, encephalitis, or the patient is of eclampsia, and the recurrence of seizure is likely, so we are going to continue the anti-epileptic therapy for 3 months, and we will withdraw the anti-epileptic therapy if the 3 months elapsed without the seizure activity. Now, coming towards the acute management of seizures. First of all, we are going to position the patient to left side and protect the airway and maintain oxygen. We are going to check the mouth of the patient if he has any dentures or is his tongue is occluding the airway. So we are going to clear that and monitor and check the blood glucose concentration. We are going to gain the IV access and send the blood samples for a full biochemical panel, complete blood count, and epileptic drug concentration. So these are the blood tests we are going to order, and if we are suspecting that the patient is of alcohol addiction or he's on alcohol withdrawal. If we are suspecting that, and if alcohol withdrawal cannot be excluded, we are going to give the IV thiamine to the patient. Now, coming towards the very important part, we are going to treat the status epilepticus. There are certain steps where we are going to administer certain drugs at certain steps, right? So, step one, the number one drug that we are going to administer in status epilepticus is benzodiazepine. So, after the 5 minutes of continuous seizures, the seizures have not stopped, and patient has repeated seizures without consciousness in between. We are going to take the IV access, and if the IV access is available, we are going to give the IV midazolam, diazepam, or clonazepam. Any one drug of the three drugs we are going to administer. And if the IV access is unobtainable, we are going to give midazolam intramuscular in the adult cases, and if the child is the patient, we are going to give the buccal or intranasal midazolam. So number one, in status epilepticus, we are going to administer the benzodiazepine. Now, if the seizure has not stopped and it cause is not reversed and seizure does not stop, we are going to take the step two. That is, we are going to administer the anti-epileptic drug. So in anti-epileptic drug, we have three main drugs, that is levetiracetam, sodium valproate, and phenytoin. So in adult patients, levetiracetam and sodium valproate are preferred. But phenytoin can only be given when levetiracetam and sodium valproate cannot be given. But phenytoin has a wide range of side effects, so that's why it is less preferred drug, and it can have the side effects of arrhythmias, infusion problems. It requires a slow infusion and hypotension. These are the side effects of phenytoin. A very important point, if IV access is not available and cannot be obtained in the patient for anti-epileptic drugs, so anti-epileptic drugs can also be given intraosseously, right? Phenobarbital can also be given as an anti-epileptic drug, but the risk of respiratory depression is very high after the administration of benzodiazepine. So in the first step, we have given the benzodiazepine, and if we give phenobarbital in the step two, there is an increased risk of respiratory depression, and also it is given. Phenobarbital is given in the intensive care settings because of this side effect. So, in case of children, levetiracetam and phenytoin are the preferred one, and sodium valproate is less preferred because of the risk of hepatotoxicity in children of less than 3 years. So, in adults, levetiracetam and sodium valproate are the preferred ones, while in children, levetiracetam and sodium valproate are the preferred ones, but levetiracetam and phenytoin are the preferred ones. So now, when visible signs of seizures have stopped, now we are going to do the EEG in all patients who have not gained consciousness. So seizures have stopped, but the patient has not gained consciousness. We are going to do the EEG. In the pregnant patients and and the patient of childbearing age, women of childbearing age, the anti-epileptic drug of choice is levetiracetam, and if the male is of reproductive age, so sodium valproate can be associated with neurodevelopmental disorders in children. when conceived with the male of reproductive age, and he is on sodium valproate. Now, step three, if the patient has not stopped his seizures with the step two therapy, that is the anti-epileptic therapy, he has been given benzodiazepine and anti-epileptic drug, but the seizures have not stopped. Now we are going to transfer him into the intensive care unit, and specialist advice is needed. So on step three, there is continuous EEG monitoring is required, and if the patient is still has seizure after 15 minutes, and step one and step two. We are going to consider the option of general anesthetic infusion. These can be thiopentone or propofol. So on step three, the patient is treated in the intensive care unit, and he is given the general anesthetic infusion. That is appropriate for the patient. Um, Now, if the patient has eclampsia, so the drug of choice for seizures is magnesium sulfate. This is a very important point. So, eclampsia, the drug of choice for seizures is magnesium sulfate. Now, there are certain complications of seizures associated with them. Number one is aspiration can happen. Aspiration can happen due to the seizures, and the patient is if the patient has anything in his mouth, he can aspirate into his lungs. The patient can also get trauma due to seizures if the patient is near some dangerous things, and posterior shoulder dislocation can also occur in the as a trauma in seizures. So if the patient is having seizure, it is advised that to remove the patient from any dangerous source that he can get damaged from. Now if the seizure is prolonged, that is in the case of status epilepticus, there can be central nervous system injury, pulmonary edema, rhabdomyolysis, acidosis, kidney failure, and hyperthermia. So these are the prolonged seizure complications. Immediate follow-up after seizures. If the patient needs immediate follow-up after the seizure activity of such type. No, if the patient has no history of previous seizures and this was the first episode, and if the biochemical panel and CBC, if not already done, we are going to do the blood glucose concentration, biochemical panel, blood count, complete blood count, urine drug screen, and CT, LP if infection is suspected. So these are the investigations we are going to do if the patient has no previous history of seizure. And if the acute treatable cause is not found, we are going to consider the epilepsy. Now, if the patient has a history of seizure but he is not on anti-epileptic therapy, we are going to investigate the patient as above, and the patient needs anti-epileptics. Now, if the patient has history of seizures and he is already on anti-epileptic therapy, we are going to explore for the triggers, because epilepsy has certain triggers. For example, lack of sleep, if there is febrile illness, or he is not adherent to the therapy, and some flickering lights, some stress factors. So these can be the precipitating factors for history for seizures. Now, so we are going to explore the triggers, and also we are going to measure the plasma concentration of the anti-epileptic drugs. So in such manner, we are going to approach the patient when we do the follow up after the seizure activity. So this video sums up for the treatment. This video sums up the treatment and management of the patient who is having seizure and status epilepticus. You do not have to go through all the text of the ETG. You can just watch my video, and you can crack the exam and questions regarding this topic. So thank you for watching. If you like my videos, kindly share among your colleagues, like my channel and subscribe. Thank you.